Good morning, everybody. Welcome to another Mancoll Minute and a week that just seems like it's flown by. Hope it's been a good one for you. Last week we talked a little bit about are you too old for plastic surgery, and I thought maybe we do the other side of the spectrum today and go talk about are you too young for plastic surgery. And when I say that, I'll break that into two categories. There is are you chronologically too young, meaning should we be doing plastic surgery on 5-year-olds? Or am I too young for a operation? For example, people come in and say, am I too young to get a facelift? And they're in their 40s. So let's break it into those two parts. From the standpoint of my chronologic age being too young, obviously as a plastic surgeon I get called for dog bites and I get called for accidents and things on newborns and on really tiny kids. So on the reconstructive side, there really isn't any age limits. You deal with the problem, and it could be something congenital. It could be, obviously born with a cleft lip or palate. But then there's the cosmetic side, which is I think what we're referring to, and is what is too young for a breast augmentation? I think we've all heard stories about the sweet 16 birthday gift of a breast augmentation. And is that right or wrong? I saw a patient this week who was right around 20 for liposuction. Is that too young? Well, I would tell you part of it is your own philosophy as a plastic surgeon. What are you willing to do? What are you comfortable doing? And mine personally is really what is the maturity of the patient, okay? Are they able to handle the consequences? Do they understand that, for example, putting breast implants are something that they'll manage the rest of their life as long as they have them? They won't last forever. I mean, it might be 10 years, it might be 20 years, 30 years. It might be 5 years. Are they willing to accept that? Can they really wrap their head around the consent issues? And of course, parents are involved when they're minors, but there's not necessarily a consensus statement that says you absolutely can't put a breast implant in a 16, 17, 18-year-old. Remember, we have patients with congenital breast asymmetries where one develops nicely and one doesn't develop at all. And in those folks, the answer is to create symmetry is typically to use an implant or to put an expander, and when they're done growing, you sort of swap it out for a permanent implant. So even though that's a bit on the recon side, it's still a cosmetic issue. So I think that is really the doctor's own comfort, and it's part of a conversation that I have with my patient, their family, and to make sure we're doing this for the right reason with the right understanding. The next issue is, am I too young for a facelift? Am I too young for a breast lift or whatever it might be? Again, I think that's up to your own philosophy as a doctor. There's a lot of people that I turn away for facelifts in their 40s because I think they look beautiful. They might have a little hint of jowling, they might have a little bit of laxity here, but we have other things we can offer today that they weren't available when I first started back in the mid-90s that we can do today. Fillers are a great way to kind of push the facelift down the road by augmenting the cheeks, filling it here, putting some volume here. There's kind of a filler facelift you can do. There's some thread lifts that might tighten some skin. We have some energies with lasers and my Renovion for tightening skin underneath. So we have lots of things that kind of keep folks from needing to go through the full surgery until things are sort of bad enough, or maybe they just simply want something more definitive. So I think that really comes down to a conversation. It really comes down to patients sitting with me and talking to me about what are their hopes, what's their desires, what's their expectations. I saw a patient not that long ago. Unfortunately, I think her expectations are she's going to look 20 again, and that'll never happen. So how do we make the best look of her 47-year-old, face and neck? And can I get a realistic expectation and result for what she wants? So those, again, come back to conversations. So as they say, age is just a number, but my job is to make sure it's the right expectation for the age, not necessarily the absolute age. So hopefully that was helpful. Hope you guys have a great weekend. Talk to you soon.